Hello, I'm Steve here with Dr. Nario of Biointegrative Health Center. As you know, we've been doing this series for a while. Dr. Nario is with Biointegrative Health Center. They do a number of treatments, and you can look them up online. Biointegrative Health Center in Reno, Nevada. Welcome, Doctor.
Hello, Steve. Thank you again for the invite.
Okay, so we're going to call this COVID Part 2. We're going to talk about COVID again, just so you know, to kind of give reference. It is July 20th, 2021, and we are talking about COVID again, kind of an update. So, how is COVID-19 affecting us right now in the present? What's different? What do we know now? Get us started, Doctor.
Well, Steve, as you remember, we had this segment before, well, way back during the pandemic, and even when the pandemic started, and things were so different from then to now. And the thing here is, again, just putting our viewers back into what the concept was. So SARS-CoV-2 is the human coronavirus that causes COVID-19. And it was first reported in Wuhan, China, last December 31, 2019, and was declared by the WHO on March 11, 2020. And overall statistics since July 3, 2021, worldwide cases, 183 million who had gotten affected, deaths worldwide, 3.9 plus million, and overall worldwide adult death rate is 2.2%. Over 95% of deaths occur in, again, we already know this, the 60-year-old and above, and the pediatric population around 0 to 18 years old actually is just 14.2% of all cases. And as you can see, it's very small, but the caveat here again, it still stands. Both for adult and pediatric or children, the predisposition in terms of how high of a risk you can have COVID is through having obesity and diabetes. And SARS-CoV-2 antibodies now, as we know, if you get the infection, I'm pertaining to that specific situation, is at least 2 years. Those antibodies in your system will last that long.
Okay, so it sounds like this is typical with life, you know. Try to stay healthy, keep your immune system strong, exercise. I think that's one of the first and most important things to remember is try to live a healthy lifestyle, you know. It's first and smartest thing to protect you. So, you know, not to get all political here, but there's some vaccines out there. What vaccines are available? If someone believes in that and chooses to find out more, what vaccines are out there?
Right, you're right. So there's so much controversy about the vaccines, but I'm here to objectively deliver what is out there. And again, everybody has their choice of not to take it or if they want to take it. So the most common ones that we always hear about, the first ones that actually came out of the market is your Pfizer and your Moderna vaccine. So these are actually what we call mRNA vaccines, meaning it's the RNA of the virus goes into your system to produce the spike proteins. The spike proteins are the one that are actually pathogenic, that causes all the trouble in COVID. And that's why as it gets introduced to the immune system, then the immune system builds antibodies to these specific antigens or spike proteins, thus offering protection. And the other one would be Johnson & Johnson. Johnson & Johnson is a adenovirus vector DNA vaccine. So meaning they use the adenovirus and put it inside there, the DNA, and then it goes now as a vaccine into your system, thus also again producing the antibodies for the specific spike proteins. And again, the spike proteins, as we all know, are the ones, even for the real COVID virus, are the ones doing the lethalities in terms of mortalities and morbidities to these specific patients. But here's an update for everybody. there's a new vaccine that's coming out. It's in the works, and studies has been promising. The name is Novavax. So it's coming soon, hopefully probably at the end of the year. But again, you'll hear more about this, I'm sure, through the media, through the internet. And it's saying that it had learned from the mistakes of the previous vaccines. So of course, new and improved. And this is patterned to the actual current vaccines that we have, like the hepatitis, the MMR vaccines. So that's why they're claiming it to be a little bit more safer than the other ones. But again, it's going to be seen in the future. Until it's not out there yet, we're not going to be knowing anything much. And again, we've been seeing allergic reactions to these vaccines. Things that people need to know are what we call the excipients, or the ingredients that may cause allergic reaction. So for Pfizer and Moderna, they contain polyethylene glycol. Yes, the one that you've been using when you're preparing for colonoscopy, it is part of that. And for the J&J, Johnson & Johnson, it has polysorbate 80. So if somebody has an allergic reaction to the vaccines, it's usually because of these components. And I've been getting a lot of questions about, hey, can you give me a vaccine exemption? So this is the answer for that. So you can only give a vaccine exemption if it falls under the CDC contraindications for COVID-19 vaccinations. So there are quite a few, only like 2 items here. So history of immediate allergic reaction of any severity to any component of the mRNA COVID-19 vaccine, so which I'm pertaining to the polyethylene glycol and polysorbate 80, or number 2, severe allergic reaction, such as anaphylaxis after the first dose of mRNA COVID-19 vaccine, should not receive the second dose. So if you can look at this, you have no choice but to get the vaccine first to find out if you are not eligible for the following vaccines that will come in up next. So basically, it's saying you have to get it. So you'll be the judge of that. I'm just telling it to you verbatim.
I'm trying not to laugh. Okay. So, update on treatments. You know, we've heard this works, that works, this medication. So, is there any preemptive type medications that you can take?
Right.
What do you think about that? Treatment options. If somebody gets it, or maybe they're afraid to get it, they don't want to get they're afraid of getting the virus, but they're also afraid of the vaccine, because I think there's people out there that are afraid of the virus and afraid of the vaccine. So what do they do? What are their options?
Well, Steve, now there's more that we know about management of COVID-19. It's an early treatment option. So when I'm talking about early treatment options, is when you start to have fever, body aches, especially if it's being backed up by a positive test that you do, like a PCR, a nasal swab that everybody does, and suddenly you start to have symptoms. The premise of COVID-19 is to catch it early. When you let it go for a longer period of time, the more complications you get into, and the less of a chance that you will overcome it. That's why timing is key. So everybody, if you have a high suspicion, get tested and see if it's there or not. So the ones that really came out now with good literature and medical evidence, one is Regeneron. Regeneron is an anti-spike protein antibody infusion, and this is only given through the hospital or the ER. So people run to the ER if you do have it. It's very safe, and it's a very safe infusion. That's something that we've been seeing with good evidence with. And as we all know, hydroxychloroquine, so this was already running during the pandemic. It's a medication for rheumatoid arthritis, lupus, and malaria prevention. It still works, and it's given usually for 5 days upon diagnosis. And another one, the famous ivermectin. It is an anti-parasite, and the regimen usually is take 1 dose. It's weight-based on day 1, and then day 3, and then 1 week as a maintenance, once a week for maintenance. And another one is favipiravir. So this is something that's available. Usually, it started in Japan, and it can be used for the influenza flu also if somebody has it, and it's taken orally. And we always hear about steroids. So not only do we use oral steroids now, but you can also use inhaled steroids. So budesonide is the name. And this is inhaled, and you can use it for 14 days, or even the prednisone pack that our doctors gives us when we have a sore throat with our antibiotics. And another one is colchicine. So this is surprising for me. This is actually for gout. So a gout medicine can actually help in prevention of the complications of COVID-19, and you take that for 30 days. And another one is an antidepressant. The name is fluvoxamine. So when you think that, wow, that's only for depression, not anymore. They're seeing actually good results with this one against COVID-19. And another key here is being on aspirin. So when you have so you would hear about the cytokine storm, about clots forming in your body. So once you have this diagnosis, especially if you're starting to have difficulty or breathing, aspirin 325 milligrams once a day is something that you can consider doing. So again, the key here is if somebody has an acute illness, it's always about multi-drug therapy, using not only one drug, but at least two in combination to put COVID on its tracks down, and to start early as possible.
Okay, so let me ask about those people who just, they like to go natural. They don't like medications. Is there natural remedies or options or things that people can do if they choose or believe in that approach?
Yes, Steve, that's where we come in. So this is where I guess for me, the heart of the management is. It's preventative, and it's also something that you can use during the actual infection. So the recommendation actually came from the FLCC Alliance, so Frontline of COVID-19 Critical Care Alliance, and it's the IMASK protocol. So when you talk about the IMASK protocol, we have prophylaxis, meaning to prevent, and also for somebody who has the infection. So let's start with the famous vitamin 3. So vitamin D3 can actually be dosed prophylactically for 1,000 to 3,000 units, international units a day. If you have it, you can go as high as 4,000 international units a day. Another famous antioxidant would be vitamin C. When you have it, when you are playing preventative, 1,000 milligrams twice a day. And then if you have the infection, it can go as high as 2,000 milligrams 2 to 3 times a day. And the other one, another bioflavonoid or antioxidant, is quercetin, 250 milligrams a day for prophylaxis. And if you have the the virus, 250 milligrams twice a day can be taken. Another one is zinc. So zinc has been heard even during the pandemic being used with hydroxychloroquine. You can take it as prophylaxis, 50 milligrams a day. If you have the virus, you can go 100 milligrams a day. And then also the famous sleep supplement, melatonin. You can take it 6 milligrams before bedtime for prophylaxis, and 10 milligrams before bedtime if you have the actual condition.
Okay, so I'm hearing this term long hauler syndrome. Can you explain that? What is that?
Yes, so Steve, this is the bigger mystery of COVID-19. These are the things that right now we don't have answers to yet specifically. And this is being targeted blindly, and we're just like, hey, whatever works, let's try it out, let's do it. So this is the syndrome. It's as understood as a complication of COVID-19, and it's starting to be more prominent for patients who had the disease, and they always appear at least 6 months after having the condition or the onset of symptoms. The thing here is our clue is that's how broad this is it's only based on symptoms. So the common symptom that we always see with this would be fatigue, general malaise, GI issues, diarrhea, constipation, abdominal issues, bloating, sleep issues, people who just has insomnia, toss and turn in bed, joint aches and joint pains, and chronic inflammation. This includes chronic headaches, chronic body aches, and the one that's really prominent are the mental issues such as brain fogs, cognitive issues, depression and anxiety, and we've even seen hair loss. And again, the persistence of the loss of smell and the loss of taste. So, what is a treatment? Again, right now, as I mentioned to you, it wouldn't hurt doing the supplemental recommendations that I mentioned. But right now, even the experts, the specialists out there are trying to conduct studies and trying to do a thorough evaluation of possible therapies and treatments. Again, there's no right answer or wrong answer for this, but recognizing it would be a big step in order for us to help our patients out.
Okay, that's Dr. Nario, Biointegrative Health Center. You can find them online in Reno, Nevada. If you have questions about COVID-19 and you want to get maybe a different angle or perspective on it, I would recommend that you reach out to them and see what they have to say about it. So, thank you, Doctor.
Again, thank you, Steve. As we all know, knowledge is power, and thank you for letting me provide you with the edge in longevity and health maintenance, which I call the biological edge or the bio edge.